Good morning, everyone, and thank you for joining us for this Tele-Town Hall today. My name is Rick Journey. I serve as Director of Communications for the City of Birmingham. I will be the moderator on this call. Thank you very much for being with us today. Thank you for the service that you provide for us in our community. I do want to remind you of a couple of things before we begin. If you have a question during this call, press 7 on your dial pad. Press 7 on your dial pad. You will then be connected with a screener who will be able to take your question and put it into the system so that we can respond to it. Also, during this call, we're going to ask you some questions to get an idea of your situation and your thoughts as we move through this situation with COVID-19. We will give you more information about that momentarily, but just once again, press 7 if you have a question. And you will be connected with a screener who will take down information on your question. With that now, I would like to introduce Mayor Randall L. Woodfin.
Hey, good morning, neighborhood officers and neighborhood leaders, and community officers and community leaders. As many of you all know, Jefferson County has one of the most senior populations in the state of Alabama, and Jefferson County is also the densest population in the state. That means a lot of us are in close proximity of each other. Today I'm mostly going to talk with you very briefly, but spend most of our time taking your questions and sharing what we are doing to protect you and your neighbors. I've also asked CAB President Jimmy Coleman to be on this call to provide some words to speak with us this morning, but let me share a couple things. And if Jimmy is not in a position to speak, then I would like for Ms. Ellen Spencer to be able to provide some words on behalf of CAB. First, the shelter in place, which was approved by the City Council early this week, is our first major effort to slow the spread of this virus that has been rampant and increasing in our community. This means that you can still get your medicine, you can still get groceries, you can still get gas for your vehicle, you can actually still go out for a walk or a ride, but you should not be in proximity to other people within 6 feet. You should not be gathering in groups. Secondly, you should be using your authority and your power as a community senior and leader and elder to discourage others from congregating. I know this is hard because we want to go to church. We want to be with our young people. We want to be in contact in close proximity to people we love and care for. But this is a temporary measure. Just like many of you all counsel young people to understand what delayed gratification means or to start saving early, we want you all as leaders in the community to lean in and help us stop the spread of this virus by calling those you have influence with. At this time, I would like to have Ms. Ellen Spencer speak on behalf of the Citizens Advisory Board.
Ms. Spencer, hold on 1 second as we open up your line.
Can you find?
Camila says she has.
At a certain point in this call, we'll either have Mr. Coleman speak or Ms. Spencer speak. In the meantime, what I want to do now is turn it back over to Rick Journey, who will open it up for our questions.
Thank you, Mayor. We are getting our first questions in right now, so stand by as we pull those together. As we're getting those questions pulled up, I'm going to ask you a question to begin with the audience on this line. The first question: do you feel that your neighborhood is receiving adequate information regarding COVID-19? Press 1 for yes. Press 2 for no. The question: do you feel that your neighborhood is receiving adequate information regarding COVID-19? Press 1 for yes. Press 2 for no. Our first question, Mayor Woodfin: should caution be taken when handling money, mail, and credit cards?
I think the answer is yes. I don't want anybody to be worried about it. I think the United States Postal Service has taken extra precaution. They use gloves. I passed by the post office this morning and saw them training some new employees, and every one of them had on gloves. So I know the United States Postal Service has taken extra steps and precautions as it relates to how they interact with mail. Money exchange, I think there are protocols, many banks as well as any other organization where money is exchanged have also implemented new standards around exchange. So I don't think anybody can be too cautious around how they engage their mail or how they engage their money. But any extra steps you would like to take as an individual, such as using Lysol to spray on your mail before you open it up or your money, there's nothing wrong with that.
So, Mr. Mayor, I wanted to let you know, Mr. Coleman, Jimmy Coleman, is on the line now.
Everyone, Mr. President, Jimmy Coleman, the mayor of North Birmingham, is now on the call. I would like for him to speak and bring greetings on behalf of the Citizens Advisory Board. Mr. Coleman?
Yes, sir. Thank you, Mr. Mayor. Rick, I just want to thank you for having this conference call so that we can all kind of be on the same page, and I want to just bring greetings from the CAB and also the CAB officers, Ms. Spencer, Ms. Adrian Reynolds, and that we are just 100% behind you, Mayor, in the situation, the way you're handling it. I think, when you talk about money and mail, I don't know how long that virus will live on certain items. They had it on there with Sanjay Gupta, and I think he was talking about it does not live long, but it's don't pay. You have to. You still can be cautious on what you do. But my thing is, I appreciate the mayor's getting things together so that we all can kind of be right together. Rick, and I thank you too. And Rick, you have all the questions for me. Thank you. I thank you, Mayor.
Thank you, Mr. President.
And thank you, Mr. Coleman. We're going to go to our next questions now as we've opened them up. Before we do that, actually, let me close out the question that we're currently on. I'll ask it one more time. Do you feel that your neighborhood is receiving adequate information regarding COVID-19? Press 1 for yes. Press 2 for no. We will close that out in approximately 15 seconds. Our next question for the mayor. Do you have data to determine what area of Jefferson County is mostly affected by COVID-19?
What I can tell you is that most of the people who have tested, separate from if they tested positive or negative, have been not in the city limits of Birmingham. So the highest number of people that have been tested have been in zip code 35242. What I can share with you is, you give me 1 second, because this is a really good question. Allow me to pull up some information. As of last Saturday, there were over 2,200 people that had been tested so far, so not including any numbers between Sunday and today. Of those, 379 have been tested in the city limits of Birmingham, and it's pretty spread out. In zip code 35215, which is on the eastern side of town, 91 people in our city limits have been tested. 35211, 37 people. 35208, 29 people. And 35207, that's over in the Mr. President's area, 8 people. 35235, again on the eastern side of town, 69. 35206, which is also east, is 46. 35222 is 22 people. 35203, 12. 35228, which is west, 7. 35212, which is portion of east and south, is 19. 35214, 21, and 35213, 39. That is that's from last week. About 379 people in the city limits of Birmingham have been tested. What I can tell you is that in this week alone, in a 4 or 5 day window, 2 test sites have now opened in the city limits of Birmingham. So this time last Friday, there were no testing sites in our city limits. Today, a week later, there are 2 testing sites in our city. One on the south side of town and the others on the east side of town.
Thank you, Mayor. I'm going to ask our next question for those on the phone. This question, what is the best way to provide your neighborhood information regarding COVID-19? Press 1 by phone call, press 2 by text message, press 3 by email, press 4 by U.S. Postal Service. Once again, what is the best way to provide your neighborhood information regarding COVID-19? Press 1 for by phone call, press 2 by text message, press 3 by email, and press 4 by U.S. Postal Service. You have about 3 minutes to respond to that call. We'll remind you before we close that question out. Our next question to you, Mayor, comes from Echo Highlands. Had a rezoning issue the same day of the shelter-in-place ordinance being approved. Our concerns were dismissed during council meeting, even though we were abiding by the shelter-in-place. The council moved forward with the issue. However, the issue should be revisited.
I imagine this question comes from the president of Echo Highlands. I was there at the council meeting, and I saw what took place. I was actually surprised that this issue moved forward. According to Councilor Clinton Woods, who represents District 1, shared the same sentiment. However, 6 councilors decided, and 9 councilors in vote, and 6 of the 9 decided not only to move forward, but allow this project to continue. I can't speak to those zoning cases that come before the council, because that's under the purview of that committee chairperson, along with the president of the council, who controls and dictates what's on the agenda and what happens at a meeting. I would share 2 things. One, to engage Councilor Woods to express that, and 2, engage Council President to see if both of them are willing to bring the situation back up before the council.
Thank you, Mayor. Our next question, who gets hazardous pay? There's 2 parts of this. I'll ask that one first. Who gets hazardous pay at this time?
No employees getting hazardous pay. All city employees have been deemed by the federal government, any local municipal government, any state government, and federal government have been deemed essential employees. We are working in our standard course of business, working our standard hours, therefore we're getting our standard pay. The second question was related to what's being made in our homeless community. A lot of things have moved in the last week around COVID-19, addressing our homeless community. I'll touch on 3 things. There is now a process where our homeless shelters have all enacted some form of checking for those who enter their building to see if they may have symptoms of COVID-19 before they're allowed to enter. So the biggest thing there is our shelters are still have their intake process, but they've created some additional steps to make sure there is no spread among their facilities. 2 is that I've seen an enormous uptick in organizations, churches, individuals, and nonprofits from a feeding program in various places throughout the city, not just at our shelters, but other public places as well, to engage in providing nourishment and food. The third thing, which is I think the order has not only been made, but I think some of them are now here. We now are in a position to place hand sanitizer docking stations in public spaces, because with so many restaurants and places closed, we have limited the places that some in our homeless community can actually use the restroom and wash their hands. So these public docking stations will be very important to making sure, just like we tell you all on the phone to wash your hands and keep hand sanitizer, we're now offering that same thing in public spaces for those in our homeless community. There are many other things we're doing, but those are some of the top things.
Thank you, Mayor. We're going to ask our current question one more time, then we'll close it out and go to your questions. Our question currently, what is the best way to provide your neighborhood information regarding COVID-19? Press 1 for by phone, press 2 for by text message, press 3 by email, and press 4 by U.S. Postal Service. We will close this question in 15 seconds. Mayor, our next question for you, would there be a possibility to have more testing sites on the western side of town, for example, Legion Field? How can we as neighborhood leaders help with the testing or even collecting supplies for the testing site?
I don't think we want our neighborhood officers to be engaging in actual being physically at testing sites. We want to leave testing sites to those health professionals, unless there are some of our neighborhood officers who are health professionals. I think the second thing with supplies is you all should know on behalf of our employees who are first responders, we've placed numerous orders for all the supplies they need. In addition to that, we continue to be in contact with the UAB health systems as well as the Jefferson County Health Department to make sure we're talking with the federal government and the state government to assist in bringing in additional supplies. The other question dealt around Legion Field and a possible third testing site. The UAB Health Systems is currently working with the leadership at Princeton and other areas. I think the thing about what's scary about a third testing site within our city limits is not having enough people to provide the work that's needed at this point. I think the other situation to consider at Legion Field is that if it rains, then we're not in a position to use that testing site because although the actual person being tested will remain in their vehicle, the health professionals are outside. I think many of you all know what happens in that parking lot when it rains. And so the service that we would want to provide, if there's inclement weather, it will prevent that site. It will prevent that site from being capable of being able to be used. So there are constant talks right now with the UAB systems, along with Princeton Hospital, to work on expansion opportunities around testing. This is a conversation we will continue to have with the health experts, but we want to lean on them as it relates to their bandwidth and capacity and not being stretched by opening up a third site. Again, remember last week, 7 days ago, there were no testing sites in our city limits. 7 days later, there are not only one but two testing sites in our city limits. The goal was not necessarily to have one on each side of town. The goal is to make sure everyone can be tested and that there is testing in our city limits.
Thank you, Mayor. And one reminder also, I believe the question dealt with if there was any way to help in any other ways. There is a PPE, personal protection equipment drive going on right now at Christian Service Mission. That is taking place. So that has been coordinated through Jefferson County Department of Health and UAB. They don't want things delivered to them, but they've got a drive going on there as well. Just wanted to point that out.
Also want to encourage you to dial to engage the United Way. They have their 211 system that's in a position to be able to help citizens in our city. So please take advantage of that and engage the United Way to see what volunteer services are needed.
Thank you. To get information to the citizens, is there a robocall in place for the neighborhood officers to receive updates?
We can look into that. I think what I've seen several things. You have individual counselors who have left messages with you all. I know Councilor Wardine Alexander has done it in District 7. Councilor John Hilliard has done it in District 9. In addition to that, each of you all, by way of being able to be on this call, also have the capability of texting BHM COVID. Again, that's in all caps, BHM COVID to 888-777. BHM COVID to 888-777. that allows you, even if you leave your home, to be able to get information directly from us instantly right on your cellular phone.
Thank you, Mayor. We are getting inquiries, for example, from Historical Committee about construction permitting. They are still reviewing applications. What should we advise committees to do? Do you continue reviewing with social distancing? We need guidance for committees.
Hold on 1 second, everybody. Well, I had to think on that question. I had to look to a team member and get some clarity on that. I still don't have 100% clarity. So, Ms. Powers, what I want to do, let me be in a position to get an answer to you by call or email, and then be able to email that answer out to all the neighborhood leaders. I think what you're seeing is, because council meetings and some of their committee meetings are still going on, then I have to work with the council on this answer.
Our next question, are there any funds available for churches at this time?
There are no funds available for churches at this time, and I'm not sure when you say funds. I don't know if you're talking about city's tax dollars going directly to a church, so I'm unaware of that.
And a second question is, will church employees be eligible to receive unemployment?
That's a good question. That answer is based on what the Department of Labor of the state of Alabama defines or determines what type of description of the employer and for that employee who they work for. That's not a determination the city of Birmingham makes. Unemployment eligibility as it relates to being able to receive a check from the State Department of Labor, they determine that.
Our next question, this comes from identified as a senior citizen. Prices have increased and can no longer afford essentials. Limited transportation options of taxis and Uber. Please speak to issues that seniors are facing right now.
Well, I'll speak to taxis. There's been no price gouging in taxis. They have a pretty standard rate, especially because they've seen a decrease in their fares based on social distancing. There are not a lot of people out, so there's no increase in pay there. It's the same for Uber. Uber only does their surcharges when there is a crowd or a lot of people requesting. We've seen some of their numbers. There's been a decrease in those requests, so they're not increasing pay either. I think the biggest thing we're worried about, and it's something we started looking into yesterday, is we started getting messages over the last 72 hours, possibly around price gouging, not just for seniors, but for any customer in some of our grocery stores. So that's something we're taking an active look at, and we'll be reaching out to the owners of these grocery stores to verify and or investigate some of these complaints. Outside of that, we are unaware of any price gouging or increasing any fees, especially for seniors.
In addition, Mr. Mayor, if I could point out too, I know that the State Attorney General's office has indicated that they were monitoring that too, so they are going to set up a hotline for folks if they see price gouging as well. Let's open up our next call, if we may, or our next question, if we may. This is the last question that we want to ask for you. Thank you for your participation in these questions. The question is, how are you currently communicating in your neighborhood? How are you currently communicating in your neighborhood? Press 1 for by phone call, press 2 by text message, and press 3 by email. Press 4 by in-person meeting, and press 5 not at all. Once again, your choices. Press 1 for by phone call, press 2 by text message, press 3 by email, press 4 in-person meetings, or press 5 not at all. We will give you about 3 minutes to answer that question, then we will close that question. momentarily. Thank you very much. Our next question, are there other cities that have been hit and are in need of larger facilities to house patients? Does Birmingham have a plan in place for overflow? Have you considered Trinity Hospital?
There is a plan that is in draft form that between the city of Birmingham, the health system, and the UAB health system and Jefferson County Department of Health, we are working on what's called space and infrastructure around if we reach capacity with our current beds for all of our hospitals combined, which include in the city limits of Birmingham, UAB, Princeton, St. Vincent South, and St. Vincent East. What do we do next? The first thing we do is look at the Baptist system outside of the city limits. But yes, we are looking at other facilities, not just hospitals that are no longer in use, such as Trinity. We're also looking at Cooper Green, and believe it or not, we're also looking at hotels.
Thank you, Mayor. Our next question comes from Airport Highlands. How do people find out where testing locations are on the east side of town?
You give me 1 second. I'm going to attempt to pull that information up.
Mr. Mayor, I'm doing the same thing right now. I had it and then I closed it out accidentally. I will point out that one of them is the Christ Healthcare Clinic that is in the Woodlawn area. It is a by-appointment clinic. What you do to contact them, they have a process. They have to limit how many they can see on a daily basis, but you text the keyword SICK, S-I-C-K, to 78,000. Text SICK to 78000. Oh, 74, I'm sorry, forgive me. My memory failed me. It's 74,000. Text the keyword SICK to 74,000. That's 74000. They are primarily looking for folks who are showing symptoms of COVID-19, and that is who they will do the pre-screenings for when they get back in touch with you. Okay, let's go on to our next question now. Stand by 1 moment. Just 1 moment, please. Okay, this question does not give an age, but wants to know if her grandbaby should or could visit her. Would you recommend that young adults in your family continue to date and see one another?
All right, let's start with the grandbaby visit. This is what I would say. If a person doesn't currently live in your household with you, then I would limit visits right now. If there's a possibility to be able to use technology to see them, FaceTime, any form of technology that allows you to be able to view your grandchild at this point and not actually physically touch them, I would lean towards that if you don't currently live in the same household with them, out of an abundance of caution. We need to remember, as this continues to increase, it is possible that people can have the coronavirus and be asymptomatic and literally not know they have it. So if a person doesn't live in your household, even for another family member, I would limit physical contact. So even if you saw them, you say, hey, I want to see my grandbaby, then your first inclination would be to hold them, hug them, pick them up. If there's enough discipline not to do that and still be able to see them, then yes. But if you can't do that, I would highly recommend another option of seeing them.
The next one was the dating question. Do you recommend that they continue?
The dating question. So if somebody on this phone don't want their grandbaby to date somebody else, I don't know what to tell you on that. But the same thing applies in all seriousness. I think how do you balance a young person who lives in a household with you, how they interact with the person in a different household. One of the things was suggested to me is before they come back in the household, they have to take their shoes off. They have to they have to do so many different things around washing their hands, et cetera, before they can engage in touching something in the house. There's a balance here of leaving your house, which again we've recommended. You can walk, you can bike, you can run. There's protocols we all put in place when we come back into our house before we touch something. So if that's your child or grandchild that's wanting to date, I suggest to just do the same thing before they're able to walk back in that house and start touching things. Make sure they wash their hands thoroughly.
Thank you, Mayor. Before we go to our next question from the audience, let me ask our final question to our listeners here. How are you currently communicating in your neighborhood? Press 1 for by phone call, press 2 by text message, press 3 by email, press 4 by in-person meeting, press 5 not at all. You have about 15 seconds to answer that question, and then we will close that out. Thank you for your feedback on that question. Our next question, will citizens that sign up for the census still be able to go out and do the census work?
That's a good question I don't have an answer to. Let me be in a position to provide that answer pretty soon. But as of now, I would say the answer. Let me back up. As of today, that answer is no. Doing census work door to door requires you to come into physical contact or be in close contact with people that's less than 6 feet. At this point, I would advise no. The good news is the census window of doing census work is still open for quite some time. So I would say at a minimum until April 3rd, that answer is no. I think this is something we can reassess after April 3rd.
Our next question, with schools now being closed, will there be a curfew in place for the younger generation? The physical buildings of schools remain closed, but school is still in. If school is still in and there's still curriculum and teachers are still teaching, they're just doing it a different way, the curfew ordinance does not go away. I don't see a world between 8 a.m. and 3 p.m. where a bunch of children just can be walking the street between April 6th and the last day of May, because by definition school is still in. As stated by the governor and the superintendent, the secretary, whatever his title is, over all the school systems across the state, starting April 6th, there is an expectation that all the school systems in the state will transition how children learn. But school is still being taught between April 6th and the last day in May. Because of that, I expect not only the city of Birmingham, but any city in the state of Alabama who still has a curfew ordinance while school is in, for that to still be in effect. Next question, if my job is not properly practicing the 6-foot social distancing rule, what should I do?
So there is not a such thing as a 6-foot rule. There is the only rule that exists is there's 2 rules that exist: a shelter-in-place rule that has exceptions, and a no gathering more than 10 people rule that has some exceptions with permission from the Jefferson County Health Department. It is suggested that you be 6 feet apart. That is a suggestion. That's not a rule. And I think I have to make that distinction on purpose, because there's no situation where in some of our jobs that's humanly impossible. But there's still other precautions and measures you can take to be safe and remain healthy. But there's no situation on anyone's job site you can mandate 6 feet apart. The best example I like to use is an airplane. Airplanes are companies that are in various states that have the same rules and the same suggestions, because the CDC is the one that's recommended to the entire nation, to all employers, to all companies, to all people we recommend 6 foot distance, but we know in every situation that's not humanly possible. You can't be 6 feet apart on an airplane. If you're in a work truck, you can't be 6 feet apart. And in a lot of other work spaces, you can't be 6 feet apart. However, there are other measures employers can take and their measures the individual person can take to make sure they're protected as well.
Our next question, what will be done for students that do not have access to computers for remote learning?
There is 2 plays being ran that had already started today. One play is the City of Birmingham is engaging community partners now in providing the actual devices to get to more students. But equally important, the device is useless unless there's access to the internet. So since we've been on this phone, I've received a text message from Charter based on the phone call I made this morning. I've spoken to Charter, Spectrum, AT&T, and C-Spire. These are organizations that provide some form of internet bandwidth to citizens' households. City of Birmingham school system with 22,000 students is about 13,000 households. A large majority of those households are in public housing. Currently, Charter, since that call this morning, since we've been on our call, have said, yes, we believe we can work out something that provides some logistical support in offering the actual bandwidth internet connectivity to these households. We haven't gotten to a yes on the devices yet because we'll probably have to engage a lot of people, but we are working on the plan for devices.
Thank you, Mayor. Our next question, can churches still live stream services since they're not able to have church services?
Yes.
Okay. Now to our next question. Just one. We have a compliment. I'm trying to get to our next question. We have a compliment from the Rising West Princeton Secretary saying you're doing a good job. No question asked here.
Thank you, Madam Secretary.
Our next question, the city has a system for sending out voice messaging. Will that be considered? Can we reach out to our counselor to use the messaging system to make announcements?
I think there's a balance here with how we use our system, everybody. I think the last thing you want is receiving messages from 12 people. So that's the mayor, 9 counselors, and 2 of your county commissioners. We can't overrun the system. We have to make sure there's some coordination among us around what goes out, when does it go out, and how often should it go out. But I think for those who are wanting some type of phone usage similar to what we're doing now, that can be arranged.
And if I may say, Mr. Mayor, also on the text message BHM COVID to 888-777, we typically try not to go over 2 messages a day because we don't want to overburden folks or let them feel like they're just getting lots of stuff that they don't need to know. It's typically just urgent messages that we try to send out.
And I told someone this. I think this is really important as leaders. I want to just speak to everybody on this phone very plainly on what I'm about to say. I received a call last night about 10 p.m. from a teacher, actually in another school system, but she called. She wanted to share with me that she was experiencing some form of anxiety because of just not being able to see her children anymore and all of these things, all the things she's watching on the news, the things she's hearing on the radio, the things she's seeing on her cell phone or internet. And I told her the same thing I want to tell you all now. Sometimes it's good to step back for a while. The stuff you all are watching on TV 24 hours a day, whether it's local news or national news, what you're hearing on the radio all day, what you're reading in your devices or in the printed paper all day, we're not in normal times. You want to be updated and stay in contact, but you want to take a break too to keep some form of sanity. So I'm saying all that to tell you, as leaders, I hope you find some time this weekend to step back from all of this stuff. Literally turn the TV off, turn the radio off, don't pick up the paper, don't read the news on your cell phone, and just take some time to step away from this to appreciate that even though we are in unprecedented times, the world has not come to an end. We still do have our families, and this is a good time to connect with them and step away from the world.
Mayor, our next question. Are you all going to still have the upcoming evening council meeting? There's 2 parts to this question, but I'll ask that first.
That was determined 100% by the president of the city council and his body. I want y'all to remember, I'm just like you at these council meetings. I am a guest. As it relates, that's why they actually call it the city council meeting. It's their meeting. They determine if they're going to have that meeting. But I will ask William Parker, does he still plan to have his meeting?
The follow-up to that is, have the various mayors around the county plan to coordinate efforts? Have the various mayors around the county plan to coordinate efforts?
Yes, we have a weekly briefing with the Jefferson County Health Department and all 30-plus mayors and the county commissioners. Recent call, I believe, was, what's today, Friday? I believe our recent call was Tuesday or Wednesday. So we are in constant contact with the other mayors in Jefferson County. Also just got a note that as it related to committee meetings, all committee meetings have been postponed. Any items that may have already been to the neighborhood and through the committee may show up on a city council agenda, but that would be up to the city council.
Our next question, is there a map that can be shared regarding how many confirmed cases are in each district?
No, I don't even have how many confirmed cases are in each district. I think what you all see is, as noted 2 Fridays ago. So, 2 Fridays ago, the state of Alabama received its first coronavirus positive case. It was noticed that they did not say the city of Montgomery. They said Jefferson County. They said Montgomery County. The second case came the same day. It didn't say what city within. It didn't say what city within Jefferson County. It said Jefferson County. And as each case comes up, the health experts have decided that they're not isolating public information as it relates to who tests positive by city. They're doing it by county. I can't explain their rationale, but information being shared by each city council district, I don't have that information. The information I provided you all earlier around zip code is based on the total number of people who have actually tested. That doesn't mean they tested positive or negative. It just means they took a test. They had to show some form of ID. On their ID included zip codes, and that's how we were able to isolate what zip codes were in the city limits of Birmingham based on who tested. That's the only information we have. We don't have who tested positive.
One other thing I'd mention to you, Mr. Mayor, and for the person who was asking that question, if you go to alabamapublichealth.gov, that's the state health office, alabamapublichealth.gov, and you click on the coronavirus banner at the top of the screen, they have a list of all of the testing efforts that are underway, but they also have a map that shows how many cases per county. So you can use that as a resource as well moving forward. So I wanted to point that out. Just one moment as we move to our next question. This question says, Mississippi's governor has overturned the shelter-in-place ruling. Is there a plan if Governor Ivey overturns our shelter-in-place ruling?
Well, I got some good news for y'all. The answer is she can't. I have no desire to go to war with the governor. I'm trying to save lives. I think all the people on this phone are trying to save lives too. For your information, though, because you're leaders, I think you all would appreciate this. The state of Alabama, as you know, has 67 counties. 2 of those counties are unique as it relates to their health departments and their health officer. That is Jefferson County and Mobile County, who have the 2 largest populations. Those, and here in Jefferson County, our health officer has powers, along with Mobile, that the other 65 health officers for the other 65 counties don't have. They can enforce their own rules and don't need state permission from the state health officer or the governor. That allows municipalities within Jefferson County to latch on and do our individual thing to protect our citizens if we deem that there is a crisis that exists. And that is the rule we're under.
So we have two more questions on this line, and then, and as we begin to wrap up, I wanted to ask this question from South Woodlawn. Could you please make a news announcement about stepping back from all things COVID? It was very refreshing and comforting.
If you ask me to make that public, absolutely, I can do that. I think today would be a good time to do that and tell people to do that this weekend. For you all, I mean, listen, I know many of y'all on this phone, you're just like me. We're worried, we're concerned about our families, we're concerned about our elders. We want to go to church and we can't. We want to spend time with our extended family and visit friends and we can't. But at the same time, what we're witnessing, we're being overwhelmed by it right now. So absolutely, I will definitely publicly share that. Thank you so much.
And our final question for this call, will the mayor post signs in the park to inform people that the park is closed, or at least have signs that inform of the social distance recommendation to be 6 feet apart?
I think the people on this phone, y'all must got some devices that hear the conversations I have, because just talked about parks yesterday, and it was one of the first conversations with the team this morning. So I do want to make a distinction to you. There is a park board who decided to technically split the baby. They closed down recreational centers. I think many of you all know our recreational centers are connected to or sit in a lot of our parks. So they closed the physical space, the inside physical space. And then for our parks, what a lot of people did was we blocked the playground equipment to make sure there wasn't physical contact. We are trying to strike the balance of having a shelter-in-place curfew, but at the same time encourage you to do solitary outdoor activity. So we want you to actually take a walk. We want you to ride a bike. We actually want you to run. We want you to skate. We want you to do those activities that don't require you to make physical contact with other people. And believe it or not, the safest place to do that in the city limits of Birmingham are 117 open public parks. So they're not closed. I think what you all are concerned about is the same thing I'm concerned about. Separate age, so some can be young, some can be adults, that people are still doing outdoor activity where they're making physical contact. So we're trying to strike the balance of having our police disperse that type of activity. We're also looking into posting signs. We're also looking into should we limit the number of people in the public park, knowing that, just think about this call. On this call right now, there are 132 people. If each of you all decided to take your family to the park, but you only interact with your family, you would say, why should the park be closed? I'm not engaging anyone that's not already in my household. So just think about what I just said out loud. These are all the things we're considering. We're trying to strike a balance. We do know this. I got a call yesterday about Green Acres Park. I got a call 2 days ago about Marconi Park. If we see young people participating in sports that are physical contact sports, basketball, soccer, football, things of that nature, they're touching each other, they're touching the same, whatever, then let us know. And we have no problem dispersing that. We're not looking to arrest people. We're not looking to overrun people. We're striking the balance between enforcement and making sure people still can have some form of movement, that they don't engage in unintentional community spread of the coronavirus.
Okay, we have one other question that just came in about funerals. What is the protocol and how will they be conducted? What about repast?
So this is a little tough one, y'all, so I'm going to be as plain as I can be. I want to start with the concern. I've shared this with you all. I've shared this with pastors. I think I've had, in the last 9-10 days, 3 separate calls with several pastors on the phone. And my conversation was church, the actual physical place where people want to be together, is one of the most susceptible places to community spread of the coronavirus, and here's why. Of all the places in our community, that is the number one place we want to hug, we want to kiss, we want to hold hands, we want to shake hands. When you add in the funeral, it gets even scarier, because just like we don't want people sneezing and coughing on each other, just like how we don't want people sweating and touching each other by playing basketball and football, there is no situation that any of us have ever been in as humans with family and friends. If we see someone crying, the first thing we want to do is console them by hugging them, by holding their hand, and all these physical embrace. And so I was just made aware that a prominent person transitioned last night, got his access to heaven. His family now has to plan for his home-going service. And I was very open and honest and candid with them in trying to strike a balance of how do you plan for his homegoing service, knowing that at this time a funeral is one of the top places for unintentional community spread because of our wanting to embrace and comfort each other. It's a hard balance to strike. So the health department outside of the city of Birmingham has been engaging funeral homes and funeral directors about the rule of how many people can be at a funeral. The city of Birmingham has not dictated that. In addition to that, I know, even on the call I received last night, separate from funerals, a lot of pastors have gotten creative with having what's called drive-in church. So think about the idea of a drive-in movie theaters where you don't get out of your vehicle, but you're still able to look at a screen. I think what you'll see over the next couple of Sundays is the creativity around basically something similar. But you may see that same overlap in an actual funeral service, because people should not be in contact with each other, especially based on the type of contact they would want to have at a funeral. I know that it's hard. I know that's unpopular. I know you're saying, but this should be an exception. But this will be the actual place. This will be the actual type of setting where you have the most community spread.
And with that, Mr. Mayor, that is the last of the questions that we have here. If you would like to close out with some comments, and then I'll remind folks how they can listen to this later.
As always, I appreciate everybody on this phone. You all do so much for your neighborhoods, do so much for your communities. And it's been weird in our city over the last few weeks. But you've tried to do everything you can as a leader. You've communicated. You've taken our cue, and you've followed directions as far as not participating in community spread. You have been co-owners in what we need to do to protect this community. You've supported shopping local, even if you can't eat in the restaurant. Many of you all have done carry-out delivery. And you continue to be leaders, even though we can't come into contact with each other or have your neighborhood meetings. Just know that I'm proud of you. Know I'm thinking about you. And I know many of you all on this phone are praying for me and encouraging me. I just want you to know that's equal. I'm also praying for you and encouraging you. And let's keep protecting each other and be safe. Thank you.
Thank you, Mr. Mayor. Just a couple of reminders. Thank you once again for being on this phone call today. If you would like to listen to a playback of this, it will be posted on the city website a little later today. It is birminghamal.gov/coronavirus. birminghamal.gov/coronavirus. If you scroll down, you will see the Tele-Town halls that we put the most current at the top. As soon as we get the final download of the file, we will put it there where you can listen to it again or share it with your friends if they have any questions.
do have a note. This note just came in. This is my last note, but it's probably a good note to end on because it's work-related. As of now, effective immediately, PEP is postponing the following meetings: Zoning Advisory Committee, Subdivision Committee, Zoning Board of Adjustment, Planning Commission. So these meetings are canceled as of now. What PEP will do is to continue to receive applications for all of the boards, commissions, committees listed above. Our staff will process, research, and prepare reports. However, staff will not create an agenda or place these applications on the agenda until further notice. I hope that's a satisfactory answer, and I hope you all be safe and have a good weekend as best as you can.